And with that, we'll jump right in. So to start, I'm going to kick it to Katie from Buffalo, who's going to walk us through what the New York Health Act is, why we need it, and what's so urgent about the need for a public health system.
Hi, everyone. Can you hear me?
Yep, we can hear you.
Okay, perfect. All right. So my name's Katie. I am a physician assistant currently working in healthcare, and I'm going to be going through some of the slides. I'm from the Buffalo DSA. So if we could go to the next slide here. So first we'll go through what is wrong with our current healthcare system. So right now in the United States healthcare system, your wealth directly determines your access to treatment. If you don't have the money to pay for it, you're not able to get a lot of healthcare services. And the system values the enrichment of the healthcare system over actual health and dignity. And the soaring cost of healthcare contributes to many burdens for the public. They can have a loss of coverage, you can have inadequate coverage, medical bankruptcy, financial rationing, surprise bills, increases in preventable disease if you don't have the coverage to prevent it, homelessness, and death. And despite the fact that healthcare is not available to everyone, the US spends more on healthcare per capita than any other rich country. So clearly we need to have a massive change in our system. The current system is profit-driven and employer-based. American health outcomes are employer labor. For many people in the American healthcare system, if you don't have employment, you're not able to get affordable healthcare. I've tried to look for affordable healthcare without employment, and it is extremely difficult. Sick people are expensive to insure, and insurers coerce them into taking on more of the cost themselves. And of course, there's a lot of healthcare services right now that insurers will just deny and not pay for at all. So Americans pay 3 times more per capita than what high income nations pay for healthcare. But what do we get in exchange? We rank among the lowest in life expectancies. We rank among the highest in maternal and infant mortality rates. And we top the charts in rates of deaths from preventable diseases. So we're putting in a lot and we're not getting much out of it. And even before the pandemic, 87 million Americans were uninsured or underinsured, and 60,000 Americans died every year from lack of health insurance. And I was doing some research into this. The definition of an underinsured person is that they would have more than 10% of their income per year going to health services, or if they were below a certain income level, it would be more than 5% of their income per year. But 10% of your income per year to go toward your healthcare is really a very significant amount. So those of us with insurance bear increasingly unaffordable premiums, deductibles, and copays. And 5.4 million more Americans lost their health insurance during COVID, as a lot of people became unemployed or underemployed during COVID. And 1/3 of COVID deaths are linked to underinsurance. In New York State alone, more than 1 million of us are uninsured and millions more are underinsured. So why does this happen? Health insurance CEOs make more than $20 million a year each, or $385,000 a week. So the excess wealth that is going directly to these health insurance companies is absolutely ridiculous. And the healthcare industry made more than $54.6 billion in profits during the last quarter alone. So all of this is contributing to our rising healthcare costs without improving the quality of care that we're getting at all. So we have a solution to stop this. And what could this possibly be? Universal single-payer healthcare. So universal single-payer healthcare is that everyone would have access to quality healthcare regardless of income. By pooling everyone into one plan and also cutting out large administrative costs, we'd have much lower overall healthcare costs. So in a universal single payer healthcare plan, you would have more choice. You could choose any healthcare provider you would want, and all medically necessary procedures and medications would be covered. There would be lower administrative costs. Providers could be freed from administrative work and spend more time on patient care. And of course, it would address the roots of healthcare inequity. It would allow people to no longer have their healthcare tied directly to their labor, and it would fix massive inequality across the board. So, why New York? New York is one of a handful of states with an active single-payer healthcare bill. It is the most viable bill of its kind in the country because it has the votes to pass through co-sponsors. So now more than ever, especially in the midst of one of the worst areas for COVID, New Yorkers need protection. If we pass the New York Health Act, we set a precedent for Medicare for all for the rest of the country, which is one of the major goals of this bill. So, what will the New York Health Act do for you and your family? I'm sure you can all imagine all of the benefit that it would give, not only in reducing healthcare costs for individuals, but especially as people have larger families, can have a huge impact there. So you'd have no more network restrictions. So a patient could visit any provider in or outside of New York that chooses to accept NYHA. I'm sure some of you have been in situations where you go to a hospital or a doctor's office that's out of network. That's an extremely frustrating situation to be in. Sometimes the insurance company may not cover it at all, even if it was emergency services that you received at an out-of-network hospital, even if it was in New York State. So that could be eliminated. And then to have all medical decisions be made between a patient and a doctor. This is easily one of the most frustrating things that I deal with, are private insurance companies denying things that I would consider to be medically necessary. So to have this eliminated would be very exciting. And then this would allow every New York resident and those who work in New York but live elsewhere to enroll in the New York Health Plan. But this would not require that you work in New York. And this would cover, again, all medically necessary services. So I think this is really a great talking point for NYHA, because especially talking with anyone who has any complicated medical conditions, they've definitely been through a situation where they have had services that their doctor would consider to be medically necessary, and they've been denied by the insurance companies. They have to spend hours on the phone trying to figure things out. So this would be a really exciting change. So NYHA would prohibit a tiered healthcare system where the wealthy get access to superior services and the less wealthy are getting access to inferior services. Universal healthcare is essential to socialists. It strengthens the capacities of the working class to organize against the capital and provides independence from the employing class, because we no longer depend on them for our survival sometimes. And it covers everyone. And as Mo will explain further, it will cost less for our state and reduce healthcare costs overall.
Thanks, Katie, for the overview. And next, Keith is going to walk us through the different funding mechanisms and what this means for each of us financially.
Okay. So the first and most important thing is that the New York Health Act saves, not the most important, but a thing to know that will probably be most shocking to people is that the New York Health Act saves New York State billions of dollars. So it is a revenue generating. So ultimately, when people are like, how are we going to pay for that? It more than pays for itself. It ends up saving the state. If you could go to the next slide. It's because it's essentially there's a progressive tax structure, and because of the way our economy is set up, such that the rich control all of it. Progressive taxation is a way to get and pay for all this good stuff and still save the state money. There's also incredible, I guess you call them inefficiencies in the way we deliver healthcare, which we're going to get to. Actually, let's just look at right now. So let's compare the system we have, and I'll point out some of the efficiencies. So next slide, please. All right, so this is a simplified schematic of how our healthcare system works in terms of finance at the moment. This is a actually very simplified system. What you'll notice is that it's incredibly complicated and very stupid. This is because basically the way we do things in terms of healthcare in America is a series of like historical contingencies and what was politically expedient at the moment, and like nobody planned. There is no system. Most people I know who study the American healthcare system, or some people I know who study that, don't even like to use those words because it's all a patchwork. And so it does, but I don't. I'll get back to you on that after I'm speaking about the coloring, what they mean what. But point of the matter is the current system, lots of money comes from lots of places. And one of the reasons New York Health Act saves money is that there's just lots of ways for like private individuals to siphon things off, rent seeking, basically, like the way that, you know, the fact that the US spends so much money on its military, it ends up enriching a lot of people who work privately for that. The way we have sending all this money around, lots of people come in and make for profit off of that. So first off, complicated. Secondly, expensive. Third off, bad. So let's see what the simplified version looks like under New York. All right, so you know, it's not a ground up reworking of the entire American healthcare system yet, but it's much simpler and fewer points of failure, fewer things that nobody understands. So like no surprise bills, and importantly, lots of cutting out the opportunity for individuals or companies basically profit off of how decentralized and stupid the way is set up. All right, so the best report, I think, that gets into a lot of these and predicts the effects of the adoption of the New York Health Act. The reason we can kind of confidently say, oh, it'll do this or it'll do that, is the RAND report. I'm going to give a brief little context to that report. RAND is an independent corporation that is, I guess, technically non-ideological, but sort of by virtue of that and working with everyone and frequently working with government analysis, they're basically de facto centrist. They've been around for a while. They employ really smart people. They don't, you know, Pentagon papers that showed that everyone thought that Vietnam was unwinnable was RAND. It was a RAND employee who actually leaked those. But by and large, they're not really our friends. They're not in our ideological camp. They're just sort of technocratic number crunchers. They were hired by a nonprofit that was legally created in New York when New York Blue Cross and Blue Shield switched from a nonprofit company, insurance company, to a for-profit insurance. Part of that deal, they had to take some money and set it aside for a new nonprofit healthcare. So basically, this was commissioned by an insurance company to show that this is unworkable, and it didn't. So, okay, that's the context. Let's discuss what the system looks like now in terms of financing and what it will look like under the New York Health Act. So basically, there are three major kinds of payments we have under our current system. Premiums, I don't remember exactly when that happened. I think it might have been the 90s when Blue Cross Blue Shield was a nonprofit. It was a nonprofit for a good long time until certain changes under Reagan, but I don't know exactly when Blue Cross and Blue Shield became for profit afterwards. So premiums are, you know, monthly payments that everybody gets in order to have access to health insurance. Most people in America and in New York State have employer-sponsored insurance, which is health insurance through life. It's a terrible way of doing things, and I know a lot of people who have a lot of problems with it, but it's still the majority, and so we need to discuss it. Basically, there's different amounts, but on average, it's about 80-20, with employers paying about 20.5% of employees' premium, and employees paying the other 80%. Premiums are so common that they're not just for private insurance. You'll note that there's all these optional premiums and other things for, essential plans, Medicare, C&D, so even public health things, public insurance have premiums. Then we have taxes. This is actually a really big deal, both in the taxes that are there and the taxes that are not there. So the taxes that are there, the main one is payroll tax, and a small tax on non-payroll taxes if you hit above a certain, I don't know, all that kind of means testing stuff that doesn't really bring any income. Those are the federal taxes. Then there's a bunch of state taxes, again, primarily income. On the more local level, there's a few more creative ways to get money, but those are the main direct taxes. Now, the indirect taxes are basically the fact that the federal government sponsors employee-sponsored insurance. It wants to do that, and that's a silly historical contingency from like labor agreements in World War II. So essentially, we let companies that pay for premiums write those off as tax deductible. And that's actually a ridiculous amount. It's almost $200 billion a year that we are not taking from corporations. And what that means is that your other taxes are higher, and like your individual payroll tax contribution federally is higher, because the government is not getting that money. So sort of as the opportunity cost for doing that, you're kind of already paying for employer-sponsored insurance that you may or may not use. Finally, there's the out-of-pocket payments, which are anything at the point of purchase, co-pays, reinsurance, anything you just buy because you don't have insurance or don't want to go through insurance. So those are the three main ways that we pay right now for healthcare. Next slide, please. All right. So under the New York Health Act, it's going to be paid for in a slightly different way. The main source of funding is a new progressive payroll tax. It sort of would replace the employer-employee funding that we have now by creating a payroll tax that is split 80-20 between employer and payroll, so opposite, and then a non-payroll tax not subject for income, not subject, a non-payroll income tax that will not be as means tested and will be just as progressive. Both of those, their progressivity, not a word, I think that's a word, is like really steep actually. So there's graphs and stuff that I didn't put in worth looking at, but essentially the result of this is that the new tax, the burden is like slightly on the people in the top 10, 90th percentile, and then really on the 95 to 99, and then really the people in the top 99th percentile, and then even more on the 99.9. It gets kind of hockey stick, very, very steep, very fast once you get off the extreme. So a lot of this is like a tax on the ultra wealthy, to the point where you could be making more than 95% of New Yorkers, and you're expected to break even. Okay. The other basically way it's going to be funded is through current federal taxes, which go to Washington and then come back to New York in order for the federal government, which shares at 50-50 in state governments' Medicaid and Medicare payment. So New York State will basically still have to keep track of Medicaid and Medicare eligibility, even though those will be subsumed under New York Health, and then report to the federal government. to get the money it would get, so it could put that into a giant pool of money. And basically, New York Health will create one giant pool of risk. Everyone will be in it, and then also a giant pool of money, and that's called a single payer system. And very good. Okay, that's the majority here. So, all right. So this is not the way it's going to work, and I'll get into some of the specifics, but here is an example of what a proposed tax might look like. You'll see that it's pretty steep, that it gets steeper, slowly increasing over time, especially on the higher end, and that the non-payroll tax is also pretty substantial. Again, that's important because a lot of the people who are ultra wealthy get their income not through salaries, but through dividends and selling their stocks and assets. So it'll be harder to just be like, I had to generate a passive income because my parents were born with property that they owned or anyway. So the reason this isn't exactly right, and it's important to note that the law specifies things about the tax, but it doesn't specify the tax brackets exactly. And it's also important to note that that's extremely common. I didn't realize this until I started studying policy, but most laws that have a lot of technical details are just do it like this. And then, the legislative research office actually puts out the actual details. So the fact that the New York Health Act as written doesn't specify the exact tax breaks is not unusual. So the reason that this is not right and that this isn't going to be what the tax would look like under the New York Health Act is because the New York Health Act recently had to take into account the fact that it is basically illegal to raise taxes on people earning the lowest 25%, the lowest quartile of income. So anyone making 25% or less of the income would have no new taxes. So they would only save money. And so taxation basically starts at making 26% of the average income of, not the average, range of income of New Yorkers. So the end result is that the system is actually more progressive than this. The entire top row is just gone. Yeah, it shifts it again even more to the ultra wealthy, which personally I think is fair given the incredibly unfair distribution of wealth and in this country. And I'm guessing if you're here, you probably also agree. So yeah, even the less progressive one still faces the majority of the income on the ultra rich, but it's going to be even better than this because now the poorest quarter of all New Yorkers, okay, literally. Okay, so the final bit of the financing we need to talk about is basically the process of getting Medicare, Medicaid. The federal government likes, or to some extent, they encourage states to experiment with different ways of providing public health, public insurance. So there's all these programs that are called waivers, where basically you write the Center of Medicaid, Medicare, and you're as a governor, and you say, hey, we want to do things slightly differently. Does this look fair? And states and if the federal government agrees, they give you the money to be used differently. With the passage of the Affordable Care Act, there have been additional, basically the things that the ACA said health insurance have to do. Now, anyone who makes one of these experimental programs that you need a waiver for also have to follow the rules, which is not a problem because it just means that, the federal government won't give you the funds if your coverage is not as comprehensive or affordable as the Affordable Care Act is, and the New York Health Act is substantially more comprehensive and substantially more affordable than the New York Health Act. So we're all good on that. Basically, this means that there may be a slight period of negotiation between the federal government and the state government about getting the money that we need to Medicare, Medicaid money that we would put to the New York Health Act. But things are pretty positive. The current Secretary of Health and Human Services is, a huge Medicaid for all supporter and basically has publicly encouraged single payer experiments on the state level. And there's also been talk about kind of ways to legislatively make it so this process is easier in case there is a hostile administration by the time the New York Health Act is passed. Basically, if there's a Democrat in the White House, this is going to be easier. If there's a Republican in the White House, it's going to be harder. Right now, we're in a pretty historically great time, and we have the votes, so none of this should be. All right, that is my very nitty-gritty, nerdy discussion of financing, and I hope you understand now a little more about how stupid our system is and how much better this one.
Oh, Keith, I think you had a few more slides at the end here, just the conclusion ones.
Oh, okay, cool. All right. So these are some of the basically the conclusions of what the RAND study said will happen after we implement the New York Health Act. Basically, healthcare spending is starting to decrease. They ran a couple of estimates, but one of their more conservative ones puts it at only 1% less and then 3% less in year 10. But that is $80 billion in savings. These are Medicaid budgets or healthcare budgets for states are usually the second biggest item. So something like a 3% after 10 years per year, again, is like billions and billions and billions of dollars in savings. And it could quibble. I would think it's higher. So basically, the reason these are is first off, there's going to be more spending on healthcare. People who don't have access to healthcare are now going to have access to healthcare. We want people to go see doctors. And of course, they're not going to be paying at the point of service. There's no cost sharing. But money is saved in the system. First off, administrative. Hospital budgets are so much of it. I think it's probably higher, but one study of it's 10% is just running their billing departments, practices to private group practices. If you don't need to track down the specific administrative code for the specific health provider and are we in network or out of network, because there's only one person paying you, that gets much easier. And that's actually a huge cost saving. Secondly, prescription drug pricing is expected to get substantially lower. This is because, and honestly, potentially, certain medical services as well. And the reason is because no one in the entire history of the American healthcare system has ever negotiated from a position of strength as much as representing all of the New Yorkers. So by just being like, A, legally it's take it or leave it, and B, the huge amount of business you're providing, there is a substantial incentive for people to cut costs. Next slide, please. Okay. So like I said, this is importantly a progressive system. It represents pretty huge wealth transfer actually, which is nice. I mean, that's like a goal, right? That and healing people. I believe it was something like current people in the lowest quartile spend 36% of their income on healthcare, and in the highest spend 24%. The New York Health Act would basically reverse that. People in the lowest income quartile would spend 24%, and the highest would spend like 35 or 36. It's like 1 or 2% more than the poorest spend right now, which again seems pretty fair to me. It doesn't make sense that the people who are least able to afford and are expected to spend the most. Finally, employer payments stop happening. So employers stop paying part of your premiums. They stop buying health insurance for you. And instead, there's this new payroll tax. However, this is expected in the majority of cases to save business money. The tax, again, it's like the number of extra layers of administrative work and it's just like the payments go here, and then they go here, and then they go create so many people sort of sucking profit and juice out of the system. And something direct like this, yes, companies will have a new tax that they didn't have before, but they'll still probably save money. That large firms and will be will do better. I think this might not be right. I think I think smaller firms actually are. Yeah. So yeah. Okay. Overall, this is actually expected to substantially boost the economy. More people having more money in their pockets and also the increase in mobility that comes from being able to leave a job that isn't working for you because you need to stay there or you'll literally die, is expected to increase employment about 2%. The low-income workers would see their wages increase a lot. Firms that will also do well, especially the ones that currently offer health insurance, like I said, they'll be saving substantial amounts. It's possible that high-income workers will receive a wage decrease, but I don't really buy it. The RAND report talked about it briefly, and it's like it's hard to estimate exactly where some of these costs will go, but I think high-income workers have enough bargaining power that they shouldn't be substantially impacted. And again, it's really only above the 95th percentile that you start spending more under the New York Health Act than you currently do, So, most high-income workers will see nothing, and it's really like not until you're at the 99 percentile that you start noticing substantial. Like seriously, like 95 to 98%, 99% are like $200 more a year. Again, the progressivity of this tax is really cool. So yeah, the extra employment is, first off, there'll be more healthcare providers. If everyone has insurance, people will come and open up, healthcare because there'll be more patients. So that's expected to generate business. And changes in disposable income. Yeah, basically, people have more money in their pockets, especially the poorest, and they'll go out and buy things that they need. I'm not really into sort of entrepreneurial shit, but this also will encourage people to go start businesses if they want to, because again, they don't have to stay working or they will die. So overall, let's look at sort of the final large talking about all this sort of nitty gritty. Next time. Okay. First off, we immediately start by setting 1%. By about 10 years, it's 3%. Again, I think these are conservative estimates. Reasonable but more liberal estimates are as high as 11 or 12% after 10 years. That's kind of a things go as according to plan. Not exactly a best case scenario, but like a reasonable things go well scenario. But even under these numbers, that's an $80 billion to the state. So 150,000 new jobs. It'll really look nice for enrollment, because when New York is like, well, who in our state is uninsured? The answer will be no one, zero, none. Like I said, 90% of New Yorkers will pay less for healthcare. This is really hard to calculate the exact amount less, because healthcare is one of those things where some people need it all the time and pay a ton. A lot of people don't use it that much, so don't pay much, but then when they need it, they pay a lot. But on average, it's about $3,000 per person per year savings. So 90% of New Yorkers will pay less in healthcare. And again, in the 90 to 95%, it's about even. And then in 95, up until approaching 99.9, it's not much until really you're in the highest. Public hospitals, I've been involved in a failed fight to keep low-income hospitals open. They are low income because they take patients who don't have private insurance, and that doesn't pay much. Well, under the New York Health Act, everyone gets paid the same. So public hospitals and private nonprofit hospitals that like actually treat the poorest and the sickest will have a huge increase in revenue. All hospitals are actually going to do pretty well because they no longer need the administrative wing, all those people who like figure out billing. And by the way, the increase in employment is including the job loss of everybody who works in private insurance right now. And the New York Health Act has provisions for retraining them. And they got like priority hiring in the new state agency. So all those jobs are with the loss of jobs that the New York Health Act will create by basically making private health insurance legal. So ultimately, yeah, this is, we like the RAND report because it is extremely thorough. They did some real fancy statistical modeling. They built 2 models and they ran them a bunch of times. It's all, good stat nerd stuff. But it is relatively conservative. And even then, it didn't come out saying what the people who commissioned the report wanted it to say. It actually came out saying, yeah, this is a way to provide all New Yorkers healthcare, save them money, and save the state money. So I bet they were not happy about that, but we sure were. There are other more positive analyses that are done pretty well. And there are a couple of like very eminent health economists who have some smart quibbles about the RAND report that make it think like it'll be even more progressive. But we just kind of wanted to present the nuts and bolts because this is like coming from outside our camp, people who are not really positive, and not really on our side, and even they have to. So, bottom line, centrists agree that the New York Health Act is cheaper and better, and it'll save money for the state, for people, and it'll save lives. Okay. Now I think we're going to be talking about certain scenarios on how to, sort of evangelize.
Thanks, Keith. Yeah, next, Mo is going to walk us through how to talk about this when we're organizing, when people have questions around these really complex funding mechanisms that Keith just boiled down. How do we have conversations around these so that we actually win people to our side? And just a quick note before I kick it to Mo, we'll have some time at the end for Q&A for anybody who is asking questions and getting missed in the chat. Feel free to hold those and we'll get to them at the end. And Mo, take it away.
Will do. Yeah, I thank you so much for breaking that down, Keith. That's what we're all here for. I just think it's awesome that like a Ford Foundation funded like Pentagon cutout who's very much against like a Medicare for all and statewide single payer, can still find that this saves money and this saves lives. We love it because it's a conservative cell phone, folks. And I think that that's really, really good for us to see, where it's like, no matter how you slice it, we're right. So let me talk about organizing for New York Health and for a statewide single payer for universal healthcare. So think about the 3 keys when you're talking to people. Be clear, we want a single public program with comprehensive coverage for all residents. So, I saw some in the chat about, does this include like undocumented people? Yes, absolutely. And that's part of why this makes it so much stronger than our current, arrangement where undocumented people are, showing up at the hospital to receive emergency care. This is actually everybody being able to get preventative care that we deserve as human beings. For all residents, that's free at the point of service, and it's fair for workers. So Keith was just mentioning the employment increases in the public sector that having something like the New York Health Plan would give us. And we truly believe that nothing else will do. No half measures, let's not mess around. We need to name the enemy as socialists. We're pointing the finger squarely at the ruling class. None of these distractions, if somebody starts going off on a tangent, we need to remind them, okay, these people are robbing you blind, you know? So it's time to abolish the profit motive in healthcare and to move towards a truly social system of healthcare. And they're the ones putting up a fight, you know? They're getting filthy, stinking rich. So as far as organizing with people, this is extremely popular. If you've ever gone canvassing for universal healthcare before, you know that it is probably the easiest thing to canvass for because everyone supports it. Everyone loves single payer healthcare, but the very, very wealthiest people who profit off of having privatized healthcare. So single payer healthcare, we truly feel, and this is on the next slide, Noah, sorry, it must be one with the force of a mass movement of the working class against, you know, capital and against the employing class that's pretty much holding healthcare hostage entirely. Single payer healthcare can help us build a strong working class base for DSA if we can get people to think differently about what they demand from their society through person-to-person organizing. We've definitely seen this in Buffalo. Our chapter has grown so much because of how hard we work on universal healthcare, where DSA nationally, I think some chapters struggle to get off the ground. Universal healthcare really does unite us as a class against the employing class. So how do we actually do this in the moment? When somebody asks you something crazy and you're like, oh my God, what the heck do I say? Just affirm them, like let them know that you're listening, you hear them, and their feelings are totally valid. It's mostly the fault of the wealthy interests that have been promoting a toxic individualist ideology for decades. So for example, like if somebody's like, you know, I really don't want to talk to you about this today. I think that this should just be handled by the federal government. You know, let's not even mess with it. So we're like, wait. You know, I agree with you. I want federal Medicare for all. Maybe don't jump right to I want a nationalized system, which I mean I do, but yeah, so I want that too, right? But then turn it back to actually answer the kernel at the core of what they're saying. Give a truthful and concise answer to the question. Don't be evasive. There's probably something true about it. Where, you know, in the example I just gave, yeah, you know, federal Medicare for all is my North Star, but think about it. Nothing has really shifted the landscape for Medicare for all since the Bernie campaign. So we need something to change to actually put on the pressure for us to get Medicare for all. So answer their concern, like, yeah, we want this. And we see this as a stepping stone. We don't see this as the end all be all. We see this as a material benefit for the working class, as well as, you know, a huge positive change in our healthcare system. And then redirect back to this. What's like something pragmatic that they can do today? So once you've answered their question, don't like get into a crazy debate with them. Don't get pissed off at them. But, you know, be like, so, you know, have you heard that our state has the 10th largest economy in the entire world on its own? This is the perfect place to try out a statewide single payer system. You know, that puts on pressure for the federal Medicare for all that you and I, it sounds like we both want. You know, I've used this on assembly members before who come up in my face with this, but you need to affirm, I hear you, I totally kind of think that too. Answer, you know, give like, you know, the grain of truth in it, and then redirect back to, well, we can do this, you know. And let me give you a couple examples of things that you might hear when you're out and about with Buffalo DSA or New York City DSA. So somebody's saying, you know, I really can't afford to pay more in taxes. Buddy, I understand your concern. Healthcare costs in the country are among the highest in, you know, for working class Americans in the whole world. I totally get that. That's really stressful. And then answer. So we're not just creating this out of thin air. We're going to be shifting money that already exists in the economy from a profit-driven insurance industry. So right now we're funneling our money, our foregone wages to line private insurance CEOs' pockets. to a public sector insurance plan that covers absolutely everybody. Importantly, 90% of us will pay less in taxes than they do now and have absolutely nothing, none of those fees out of pocket that we're all so used to every time we refill a prescription or go to the doctor, like our deductibles, our premiums, our co-pays. So paying more in taxes, let's reframe that, you know, and then redirect. So the only people who are actually going to pay more under this are the very richest New Yorkers. So like Keith was mentioning, like the top 5%. They're extremely undertaxed in our massive economy, and they should have the burden of paying for healthcare. The special interest groups want us to be divided against each other instead of against our shared enemy. So that we don't achieve transformative change in our economy, so that we stay tied to our employers. But the New York Health Act is really in all of our interests. Even the employing class, hell, they got healthcare, so. So I think that this is a really important one. Insurance industry is a huge employer, let's be real. Will I lose my job? I totally understand. The New York Health Act is going to dramatically transform our economy and the big employers in healthcare. But, you know, answer with something really genuinely reassuring. While insurance companies, like private insurance companies, are not going to operate in New York State anymore, the bill will create an entirely new public sector administration that is going to need to be staffed by thousands of New Yorkers. And the displaced workers from the private sector are going to be the first ones hired for those. So some studies actually show that it's going to improve overall employment by 2%. And as we know, union density is much, much more in the public sector. So those jobs have stronger employment protections, better benefits, higher wages. And then redirect. How can we win this together? We can have a system that works for everyone without funneling that money through private companies, without, you know, having them as massive employers here. We deserve a public sector healthcare system. New York State has the money, has the resources to socialize healthcare while having strong employment. These myths are honestly created by the insurance industry and the politicians that are beholden to them to protect their money, their bottom line. How does this affect freelancers? I think this is a pretty easy one, right on its face, right? So yeah, totally. I'm sure healthcare is a huge concern for you right now, for small businesses, for people who work freelance, work gig. But, you know, answer that straight up. Working contract or gig is really, really good for flexibility. That's why a lot of people choose it. So you can decide how and when you work, but employers don't have to offer any benefits in those situations. So a lot of the workers correctly understand that in trade for the flexibility, they're sort of getting scammed even harder than the rest of us who are employed for a wage. So a lot of working people in those positions go uninsured or purchase their insurance for the market from the marketplace, or purchase their insurance from the marketplace. And that patchwork system is far from universal coverage, not at all. So redirect. Let's talk about real flexibility. If we shift to a system where healthcare is guaranteed through one public healthcare system that covers everybody, now that's flexibility. People can move jobs easily. You can leave an abusive workplace situation. You can make your own business if that's what you're trying to do. You can work gig without fear of, you know, getting hurt and getting sick and not being able to afford going to urgent care, or the stress of maintaining your extremely costly insurance. Businesses also would lose that unpredictable and always increasing cost of insuring their workers, which means you can hire more people and pay better wages. That's a healthier workforce. It really does benefit all of us. Some people might have like sticker shock, like, oh my God, this is such a huge change. I don't see how we can afford this. Affirm that, that's easy, right? I totally get it. On paper, it seems like a lot of money. It seems like a really, really big program. getting rid of all the private insurance companies, that's huge, right? But right now, we are wasting so much money in the overly complex way that our healthcare system is set up. And guess who it benefits? So by redirecting the money that already exists in the economy, but's hoarded by the 1% into one single payer in the public sector, we can significantly reduce costs and insure more people. Not only is this going to reduce overall costs and simplify administration for New York State, it's going to save us $2,800 on average. And then redirect. Like I said, point the finger squarely at the enemy. We are paying so much money in healthcare because it is driven by profit. We can have a better system without funneling the money that already exists in our economy for healthcare through these private corporations. It's going to take an army of working class New Yorkers to win the healthcare system we deserve and defeat the special interest groups who don't want this to happen, though. So won't the very wealthy who you know, the higher taxes might fall on just leave the state? You know, I totally get that. I understand your concern. This bill does tax the rich, which, by the way, is honestly a pretty popular slogan. So answer that. It is a misconception, though, that they're just going to leave if we tax them. The wealthy do still have ties to the community in the same way the rest of us do. They're not going to leave if they tax more. They live here, they work here, they have family here. And in fact, New York is one of the most undertaxed states compared to how large our economy is. Like I said, 10th largest in the world, the size of Canada on its own as a state. This is the perfect place to experiment with a statewide single payer system that could shift the landscape for federal Medicare for all, which is, of course, huge for the working class and huge for our fight for a fully nationalized system. We know. But then redirect it. What can we do now? The rich want us to believe that they will leave if we force them to pay their fair share. They've showed us time and time again that that's just not the case. They want us to be afraid of instituting any mass change, and to defeat them, we need each other. We need a mass movement.
Thanks, Mo. And then to wrap it up, I'm just gonna quickly discuss where do we go from here? How do we go from all we know about why NYHA is better and how to improve all our health and all our wallets to getting it passed? So like everything, we organize to get there. We have to always be campaigning to make free universal healthcare a reality in New York and ultimately across the country. We door knock, we canvass our neighbors to gain support for NYHA and Medicare for all legislation, organize political education like this about the New York Health Act and Medicare for all and the contradictions of our healthcare system. And we pressure politicians to support single payer, make them feel as if they're going to lose their jobs if they don't support it and they don't get NYHA and Medicare for all passed. So how should socialists campaign in Albany? Pretty flatly, Albany is one of the most corrupt state houses in the country. Just a quick 101 on Albany. The state Senate has 62 seats. The Assembly has 150. Bills are passed through committees to the body, and then the body votes. The governor then has 3 days to sign a bill once it's passed in both houses, or it can veto. She now, this is a little outdated from Cuomo. I realized I missed that. Cuomo historically, and Hochul is unseen to see whether she will follow in his footsteps, but Cuomo historically would veto many bills at the end of the year in November and December. And the governor in general almost entirely controls the budget process, as anyone who is involved in Tax the Rich saw last time around. So in the NYHA campaign, we're involved in a big coalition with different partners who employ all different types of strategies and tactics to try to pass the New York Health Act. Some of the strategies that our coalition partners use are narrative-based strategies, growing and showing popular support that translates to political pressure on lawmakers through things like petitions, call-in days, lobbying, rallies, press, and then implicit or explicit electoral threats as well. DSA employs a little different of a strategy. We participate in the coalition strategy and tactics and work with these groups, but we also prioritize community organizing. We're not just in Albany to make new laws, but to build working class power and pass reforms that attack key industries. We don't rely specifically on legislators to do the right thing, but we build a mass movement to give them no choice. Like I said earlier, make them feel like they'll lose their jobs if they don't do what we want. So what does that mean? We work with a big, broad, statewide coalition. We ID legislators who can stand up to leadership. We target both our friends and our enemies. It's something that's becoming more and more important for the New York Health Act campaign, as we realize that there are a lot of members who sponsor it that aren't ready to make it, to push it for a vote. So we keep the pressure on them even after they sponsor it. We want to have a strong media game that builds buy-in across all stakeholders. And most importantly, a strong elevator pitch. So when we get asked the questions that Mo just went through and other hard questions, we know what to jump back to, and we know that we have a good pitch that everyone can get behind. So where's the New York Health Act at now? In the Assembly, we have more than a majority of Assembly members signed on. We had that as of a few years ago. In the Senate, last session, it was reintroduced with majority support for the first time ever, which was a huge milestone for the bill. Hochul, it's not totally clear yet where she falls on the New York Health Act. Cuomo did not support the New York Health Act. He said that he preferred it on a federal level, not on the state level. And we are moving forward, assuming the same about Hochul, but are hopefully can be pleasantly surprised there. And public sector unions, there's been some major pushback from union leadership, but we're confident that we can get unions on board through a coordinated and strategic approach working with rank and file union members. There's a misconception that union members are anti-NYHA, when really it's not the case. Union members would benefit the same as all of us from New York Health Act. So in New York City, what have we been doing to pass it? For the last couple of years, we've been regular tabling and canvassing for the New York Health Act, like you can see on that picture on the right. Ongoing one-on-one sessions on how to pass the New York Health, working with union members to demonstrate rank and file support, holding healthcare town halls with DSA slates and electeds, and engaging with local fights for health justice, including a recent campaign that Keith mentioned to stop the closure of the Kingsbrook Jewish Medical Center, which is a safety net hospital in East Flatbush in Brooklyn. It was a long, ultimately unsuccessful campaign, but one that brought in a lot of people to the New York Health Act fight. Mo, do you want to talk about what Buffalo's been up to?
Sure thing. I love these pictures. This is my committee co-chair Jenna knocking on a door during one of our canvasses with my husband, and we were doing a street canvas outside of the CEO of local Blue Cross Blue Shield's $1 million condo in downtown Buffalo, and we got so many pledges that day. But anyway, so our approach is a little bit different. We do weekly door knocking canvases, as well as like just street canvases where, you know, you go to a like popular intersection and talk to people there, go to events where a lot of people are going to be, talk to them there. But our actual ask is a pledge. So we're asking people to pledge that they will withhold support from a co-sponsor of the New York Health Act. Like, I won't donate to you, I won't vote for you. If you do not caucus with downstate electeds like Senator Brisport, Assemblymember Mamdani, who are great champions of New York Health Act, and DSA members, you know, we want to basically slap it on the table when the session starts in 2 weeks, January 5th, and be like, hey, hundreds of your constituents, co-sponsors, are going to withhold support from you if you don't actually caucus to get this shit done. So let's get this bread, come on, chop, chop. And I know that that's like a sort of militant approach, but hey, what can I say? And we've made a video and doing these statewide political educations, and also starting to work with union caucuses to make healthcare caucuses to demonstrate rank and file support. Our co-chair Andre is working in the building trades, and we have a couple members in CWA in healthcare and different like administrative and office jobs who are starting healthcare caucuses. Oh shit. Also, we are throwing a party, Happy Healthcare New Year. It's going to be the big event for the chapter. Vaccination proof is required, of course. We're going to sing karaoke, reveal the amount of pledges that we will have gotten by that time. I hope it's going to be over 500. I actually think we're going to get there. Have treats, you know, just celebrate the progress, thank our volunteers, thank people who let us in on their doors. We did like a recontacting to talk to everyone that we have, you know, already talked to at their doors, as well as members who aren't that involved. And yeah, we're hoping that it's going to be an absolute banger. So if you're here from Buffalo, I'll drop the link in the chat. Hope to see you at Dubs Hall the evening of the 29th for a total rager in celebration of getting single payer healthcare this year.
Thanks, Mo. And then in New York City, New York Health Act has just been reprioritized by the New York City chapter. And the Healthcare Working Group remains one of the priority campaigns in New York City-DSA. So over the next year, along with our tabling and phone banking and canvassing for the New York Health Act, we're also going to work to pass a suite of 5 bills related to long-term care with our electeds to build constituencies for NYHA. It's a strategy to bring in people that aren't involved in the New York Health Act fight and work with the power we have in Albany to bring them in. We're also going to be campaigning with our newly endorsed candidates for the state Senate and Assembly around the New York Health Act to make that a central part of their campaigns as they run for office in the next year. And finally, as Mo mentioned, we're working to build a rank and file union movement for New York Health Act to push back on the narrative that union members are anti-NYHA. In the city, we're working mostly with DC 37 and UFT members to form healthcare caucuses in their unions and their locals, and to agitate for memos of support within their unions to challenge this idea that union members are anti-NYHA and that unions don't want it, because we find that rank and file members want it as much as the rest of us do and would benefit as much as we would. And finally, if you're not involved, get involved. This is your chance. The New York Health Act fight is going to take off very soon. We have a real chance of passing it this year. We still have a majority of sponsors in both houses. And the pandemic created a moment that that made single payer more urgent than ever. I will drop all of these links in the chat and also send them out to everyone's emails after who are RSVP'd. But please get involved. It's in my biased opinion the easiest thing to organize around because everybody wants better healthcare. Nobody likes their healthcare system. And that's all we had today. Thank you everyone for coming and for talking health financing with us. If anyone has any questions, I know there's been a lot in the chat, but if anybody has any questions that we didn't answer, feel free to ask them now.
I have a question. If anybody wants to come up to a postcard petitioning event, we got one going on Friday, 1:30 to 3:30 p.m. So it's not too good if you're working, but if you're out of work or you're not working on Friday, like me, I won't be working Friday. So 1:30 to 3:30 p.m., 79th Street and Broadway, we collect petition postcards. We've collected thousands of these. The idea is to bring tens of thousands up to Albany and plunk them down on the dais of the legislators when they go into into this, before this comes to a vote, when they have to start bringing this to a vote, we want to bring that, it's going to be dramatic. More than like sheets, it's a separate postcard. So it starts being a big pile once you get over 1,000. So they're collecting them all over the state, all different groups, including our little group here on the Upper West Side in Harlem called Grassroots Action. And lots of us are DSA members. I just made the mistake of paying 15 instead of whatever the minimum was. So now I'm paying 15 a month, but happy to do it. And I wish I could come to more DSA meetings, but I love being in the street. So I got to be up here and tabling, and you're invited.
Thanks, Daryl. If you want to share with me the link to sign up for that, I could send it out in the email to everyone when I send out the recording after.
Okay, there's no link to sign up for this. It just came. Somebody said, I want to lead a table, and they said it yesterday. And so we haven't had time to do anything but like start calling people and like texting people. But sometimes these things are like, it's like sort of like the Bernie campaign. It's like all of a sudden it's like, yeah, there's going to be a table. And yeah, so there's no committee meetings or nothing. We just go like, all right, let's go. But since I'm here, it's my duty to tell and invite folks.
Well, everyone should go. Like I said earlier, this is the easiest and most fun thing to table around because everybody wants better healthcare.
I'll put the date and the location.
Dan, go ahead. You said you have a question.
Hi, can you hear me?
Yes.
Yeah, so I know that the New York Health Act covers reproductive health care, which is fantastic. Would people from other states be able to come here and get an abortion if they need one, or is there like a long residency requirement? Because that would seem like that would be a good idea, especially what the Supreme Court is about to do.
Keith, correct me if I'm wrong, but I believe you have to either live, work, or study here to have access to New York Health.
Yeah, you would have to be a permanent resident or work here full time to have access to that. So unfortunately, we can't. The law wouldn't do anything to protect people outside of our borders from restricted access.
Okay, I know during like Tish James's brief gubernatorial run, she had the idea of like a separate fund that would pay for that stuff. So maybe that's something DSA.
A lot of the sort of general, in my opinion, the smarter parts of the progressive movement are trying to figure out how to like preemptively, in general, you know, the more mainstream left than us too are trying to figure out what preemptive stuff blue states can do to protect all of that. So yeah, a lot of people working on it. Hopefully something.
Yeah. Wally from the Bronx. Is there any specific language in the bill pertaining to mental health and substance abuse treatment, as well as treatment for children or adults with neurodevelopmental disabilities such as, you know, ADHD or, you know, autism that you know of?
Mental health services, yeah, anything medically necessary is covered by the New York Health Act. So mental health services are covered. Anything related to disabilities would be covered. It's in general fairly more comprehensive than any other private insurance option right now.
Love it. Yeah, because I hate having to struggle even with Medicaid, just the hassle of the bureaucracy when it comes to having to get the mental health treatment that I need. Yeah, and also having to deal with school at the same time in the middle of a pandemic. Yeah. Yeah, I feel like the New York Health Act alone, it being a thing, if it was already implemented, yeah, I'd be better off.
If no other questions,
I have a question.
Oh, go ahead.
I have a question. Hi, my name's Chris Stanfield, and I work with GANI. I'm part of our health committee, and we are out on the streets soliciting for the New York Health Act. And I'm a little troubled by this sort of greater, in terms of its the payment for the New York Health Act, that if you make greater than 141,000 and something, then that seems to be that's the biggest amount. And that reminds me, I think, of for Social Security tax, as opposed to like taking it. I mean, if there were, I don't remember how many billionaires who live in the state of New York. Like I don't think there should be such a thing as billionaires, for example. Like, I don't know why this just doesn't like that if it's a graduated tax, why it just doesn't go to the moon.
It does. Those numbers were like mainstream and preliminary. They were sort of like what sort of the majority of people would follow, but the tax itself is specified as progressive and specifically very aggressive, very progressive in the most. To be completely clear, the majority of this funding for this bill is in the 99%, and even more so in the 99.9 and the 99.9%.
Good, so thank you.
Yeah, there isn't a like cap above which the tax stops working. And also the sort of putting substantial effort into non-payroll income, I think will also capture a lot of those people. A lot of those people, their wealth doesn't come from salaries, but comes from, assets or rent from land they own, things like that. And so the fact that it sort of more equalizes payroll, non-payroll also.
Okay, thank you. I appreciate that. Thank you.
Me too.
It includes that other income. It includes that stock income and all that other income that's not usually included in income tax.
I have a question.
Elizabeth, you mentioned you have a question.
Yes. Am I correct in understanding that with this bill, New Yorkers over 65 who are currently on Medicare will be folded into the New York plan instead?
Yeah, so you would be anyone on Medicare and Medicaid would be moved on to New York Health, along with anyone on any other.
And will New York Health cover the things that aren't currently covered by Medicare, like hearing aids and glasses?
Yes, it will be far more comprehensive. Yeah.
Oh, that's wonderful.
And T.
Wally, is your hand raised because you have another question?
Yeah. So, I'm fairly new to the healthcare working group. So I was just wondering, like, in terms of power building, what's our sort of on the ground strategy when it comes to building support, for, the New York Health Act? Like, what, are we partnering with any specific like labor unions? Are we targeting like, specific sort of professions like insurance and healthcare service workers? And also, like, what's that looking like specifically in the city? Because, I've heard a lot of great stuff about Buffalo, but like, I just don't know enough about like what's happening in terms of health organizing in the city, aside from like probably Queens and Brooklyn, but more so in the Bronx.
Yeah, so in New York City, we have field teams in every branch of New York City DSA. So that's 3 in Brooklyn, 1 in Queens, 1 in Lower Manhattan, and then 1 in Bronx and Upper Manhattan. And those field teams, when the session starts, will start doing weekly canvasses for the New York Health Act, where we'll set up tables or go door to door and talk to constituents about the New York Health Act and encourage them to call either their legislator or the the speakers of the House and the speakers of the Assembly and the Senate and pressure them to push a floor vote for the New York Health Act. We have the number of co-sponsors we need, but we need to push for a floor vote. So that's really what our tabling is about now. In terms of who we're targeting, we aren't targeting any profession specifically. We're focusing more on geography in New York City. So the areas of the city that can put pressure, that would be more receptive to a message around New York Health and can put pressure on those legislators. On your question around unions, specifically, we're working in DC 37 and UFT down in the city. But there are other unions as well where members are pushing for the New York Health Act, but those are the two big roadblocks that we see right now in terms of public sector unions. And then finally, there are 6 DSA members from the city that are in the Senate and Assembly, and hopefully after this session, some more. And we're working with them we have what we call an inside-outside game where we work with them to move on the inside while also putting pressure on the outside. And that's one of the unique kind of advantages that DSA has. We have those electeds who are members that we could work with. I hope that answered your question, Wally, but let me know if I'm missing anything. In the meantime, Courtney, is your hand up because you have a question?
Yes. My question is, are there limits on care, such as only 50 therapy appointments, like physical therapy appointments a year, or only nursing care covered for 4 months out of the whole year, stuff like that? How is that handled?
The language in the bill is anything medically necessary. It doesn't specify like any specific limits on, you can only go to physical therapy X times a year, or you can only go to this doctor Y times a year. If something's medically necessary, it would be covered under the New York Health Act.
Yeah.
Okay, so as long as your doctor says that you need it, it's covered.
Yes, yeah, exactly.
Cool.
I have a question.
Yeah, go ahead.
My name is Paul Cooper. I live in Kingston, New York. I've been working on and off on NYHA for many years, and everyone I know seems to agree that we need better healthcare. It needs to be totally reformed, yet there seems to have been a fierce resistance to it. Where is it coming from?
Mo, do you want to take this one? I feel like you always have a good answer to this.
Where is the resistance to single payer healthcare coming from?
Yes, because everybody's been working so hard to try to get it passed, and yet it hasn't happened. What's the chief blocks that are keeping us from doing it?
Yeah, so I would say that it's not in their financial interest if the New York Health Act passes, right? Because then, so right now, we're literally, my co-pays every time I fill a prescription, every time I go to an appointment, is lining the pockets of the CEO of Blue Cross Blue Shield, because my foregone wages to my employer, it's going right to the insurance company, right? So getting rid of that just parasitic layer of our economy would be really, really good for working people, but it would be really, really bad for this enormous part of the private sector that is so politically influential. So yeah, they're resistant to it because they're getting fucking rich, in the very beginning of the presentation, we talked about how, nationally this sector makes 200 billion in profits annually. It's extremely powerful, and then even during COVID, they were making out like bandits. So yeah, I would say that it's they're class enemies. is the short and sweet of it. And our interests are fundamentally counterposed.
Then our opposition comes from the actual legislators themselves, who are influenced by these financial interests?
You could definitely say that because they now know they're playing with live ammo, and there's actually the amount of, you know, co-sponsors, you know, people who say that they will vote yes if it comes to a floor vote, that the pressure is absolutely on. So the propaganda is on. That's a massive part of the opposition. And then it's not just good work that gets it done. You know, you need a real mass of people behind it. And I think we're getting that. Of course, you know, it sucks to have to organize your class and organize the politicians, you know, to make this change. But we're really small. The left is extremely small. So making what seems like the smallest of changes can seem like a massive struggle. But our interests are counterposed to theirs fundamentally.
Thank you for answering my question.
Oh my God, of course. It's a good question.
I'll also add just because it's tough, I think, sometimes to get bogged down in how long this has been going, but there have been just so many positive developments in the fight for NYHA just in like the last 2 years, with getting a majority of sponsors in both houses to Cuomo not being in office anymore. I mean, that's something.
Yes. You're right.
To this becoming something real and something feasible and something that could happen in the next couple of years, to a degree that I don't think anybody thought would happen. Roger, you hand up for a question.
Yeah, I wanted to ask, how much on the 80-20 rule, how much would the employer be saving in the tax hike, how much more they would be saving than what they're paying for their employees' insurance now? Do you know like the percentage?
I don't know an actual percentage, but I know that the larger, the more employees they have that they're currently paying, the more their savings are. I know that doesn't actually answer the question. Yeah, I'm not.
Okay, yeah, because so I would imagine that they would, even though they would be there would be like a bit of a tax hike on them, it would still be less than what they're currently paying for their employees now, correct?
Yeah, that's what Rand concluded. I don't remember seeing like any good charts that they had or any like strong data. They did conclude that, though. I mean, they discussed it at length. I'm gonna go look back into that, see if there are any numbers with that.
Okay, because yeah, we got to pass it now since the sponsor is retiring. You know, so it's imperative. I don't know who would take that up if we don't pass it next year. You know, so
there are a number of strong. I mean, look, Gottfried not being in the assembly and not heading the health committee is sad. He's done great work. He wrote it 20 years ago. But he's not necessarily going to be entirely gone from the New York political scene, so he could still have influence in wherever he ends up being. And there's plenty of very strong champions looking to continue the fight along with it. So yeah. Yeah, and Rivera, the Senate lead, is still there, still fighting.
Oh yeah, but he's in the Senate though. I was talking about, you know, in the assembly, you know. Yeah. He's been there way before, you know, Rivera got there. So I mean, yeah, you know, I just, you know, concerned about, you know, them dropping the ball in the assembly. So
the Assembly had majority support earlier than the Senate did. There are 4 DSA Assembly members, and you know, hopefully, knock on wood, some more in the near future. You know, I'd love to see him stick around longer too, but it's I think the fight's in good hands.
It's a well-deserved retirement. So,
and again, he's not going anywhere. You know, he writes an op-ed, people will still listen.
Adam, go ahead.
First, yeah, I agree that I want to echo your concern, Roger. We got to get someone good in the Assembly. It has support, but you could, the way a lot of even the most left-wing legislators work, there's always a few things circling around at once. So whoever takes the lead in the Assembly, they should dedicate their entire office capacity to it. And I know that the people fighting for the Health Act are going to be considering that. And then I wanted to bring up what the gentleman from Kingston said, I think Mr. Cooper. But why it hasn't happened, that's like, you know, you could really go crazy with that, especially when you start to meet with them and talk to them and hear what they have to say. Is every like Democrat who will never really fight for this, will like co-sponsor, but they'll never really move it forward, they'll never vocalize their support for it, are they all taking marching orders from Aetna and United? Not necessarily. But they're in Albany. The leadership of the Democratic Party in the state certainly is corrupt and entangled with the interest of capital that Mo said. And a lot of the problem is actually a cultural problem and a way that they think about politics, which is this kind of path of least resistance. They're thinking, well, there's no real consequences yet to not doing this Health Act. But if I support it, I'll make enemies on the inside of the party. You know, they'd all have to rebel against leadership at the same time. Could they actually do that? Yeah, probably. But who's going to start that, right? It's almost like a collective action problem. Who's going to be the first few groups of legislators to say, you know, I don't care what Keisty says or Stuart Cousins. You know, I want to vote on this now, and I'm not going to shut up about it. We haven't seen that rebellion yet, and that's like a cultural problem with liberal politics in the state. But the legislators can be on our side if we give them the strength and the resilience, and we push, and when we provoke them, it's not even to when we push them, it's not to antagonize them, it's to invoke the strength in them, you know, to take our side. That's on the lobbying angle, at least.
We could get someone to primary Cousins. That'll put some heat under her.
Well, thanks, Adam, and everyone else who asked questions. We're about out of time, so I'm going to wrap it up here. I'll send out the recording and the slides to everyone who came. And if any questions came up that we didn't have the time to answer that you think of later, feel free to reach out to us and we'll do our best to answer it. One more just quick encouragement to get involved if you're in New York City or Buffalo, to join our respective healthcare working groups and join the fight for the New York Health Act. But on that note, thank you everyone for coming to this tonight, and I hope it was informative.